So being compassionate in allowing ourselves to feel our feelings, even if they don't make sense. Maybe they won't make sense later. Maybe they will make sense later, but being non-judgmental and having that compassion for ourselves. My name is Alexa Enyart. I am an associate marriage and family therapist in the state of California. I received my master's degree in clinical psychology from Pepperdine University. I started my career in the psychiatric health facility, so a locked unit. I then continued to work in treatment centers, so I was working with clients with dual diagnosis. I worked in an IOP, and I also worked in a more residential facility. So I specialize in anxiety, depression, trauma, addiction, eating disorders, attachment issues, relationships, and I work with couples. So my self-healing journey it's ongoing. To me, it's a lifelong process. I started therapy about 8 years ago, and I initially started therapy to address my own trauma, and I've continued going to deal with other issues that I've experienced in my life and really just to find myself. So therapy is one aspect of my self-healing journey. There are times where I have gone more and there are times that I have gone less. So outside of therapy, I do think that the routines and the habits that I instill in my personal life are just as important as what I've learned in therapy. So using the tools that I've gained from my therapist, as well as practices that make me feel true to myself, whether that's exercise, it's physical activity, it's spending time with loved ones. I engage in daily journaling, which helps me feel mindful and present. I do love reading, so sometimes these activities for me are more spiritual in the sense that they're true to myself, and sometimes they're more just hobby or different things, different times of year that I feel are beneficial to me. And there's no one right or wrong answer. So I'm curious about the things that will make me feel present, that will increase mindfulness, and I engage in those activities. Everyone's therapeutic journey is different. You can expect that I will be by your side. I'll provide you with emotional support. I'm going to validate your successes, and I'm going to encourage you during your challenging times. Coming from a non-biased perspective and a non-judgmental approach, I'm going to help you see your current situation from a different perspective. So I use a psychodynamic approach. That's my overarching modality. And with that, I will draw connections from your past and help you understand how they may be impacting your current situation. So understanding that the different experiences that we've had throughout our lives, they're going to continue popping up. They're going to make themselves present and known in your current life, and they don't necessarily have to be bad things, right? Sometimes we remember positive memories, and that impacts how we are in relationships or how we interpret things that are going on in our current situations. And so understanding how maybe things that happened in childhood or adulthood, early adulthood, adolescence can all impact who we are as people right now, right? Everything that we've been through influences the person that we are. And so in your journey, I'm going to help you draw those connections. Session, I do believe that every emotion that we have, every feeling that we experience is trying to tell us something. So I'm going to ask about your symptoms. I'm going to ask about if you have anxiety, is it in your mind? Is it in your body? Are you experiencing racing thoughts? Are you catastrophizing? Are you thinking worst case scenario always? Maybe you have a fast heartbeat. Maybe it's hard to breathe. Maybe you sweat or you have tingling in different parts of your body. So those are all important. So in our mind, we have racing thoughts. We have clouded judgment. And in our body, we have somatic symptoms. So that can be a headache or that can be a stomach ache, different things going on, and understanding the root of those symptoms. So is it something, maybe it's stress, maybe it's dealing with relationship conflict that is causing anxiety, or maybe we're adjusting to a new situation that is tumultuous and it's bringing up different aspects of our past, and that's stressful for us. So understanding our different symptoms is important. And also knowing how to deal with those symptoms, right? If we're experiencing anxiety, there are different things that we can be doing outside of session. So, thought identification exercises or deep breathing. I love different forms of meditation, mindfulness practices. So, practices found in dialectical behavioral therapy can be really important in addressing anxiety, but it can also be helpful in addressing symptoms of depression. So the sadness that we feel, is our sadness chronic? Is it all the time? Do we feel exhausted, right? Are there things that we can be doing to regulate our emotions and to increase the ability that we have to tolerate the distress? So some people, they have sadness that is occasional or it's situational, and some people have sadness that it seems to just be never ending, right? It doesn't go away easily, and it seems like from the moment that we wake up in the morning to the moment that we go to sleep at night, we're sad and we're tired, maybe we're irritable, we have these symptoms that are pervasive. And so we can work on that in therapy. We can work on tools that are going to decrease these symptoms, and we can work on the symptoms in therapy, and I will also give you the tools to work on outside of therapy. When working with couples, I use a Gottman method approach. So, understanding how you communicate with your partner. Are there things that you are doing that are giving them signals how you feel about their relationship? Are you fighting a lot? Are you blaming your partner? Maybe you're blaming yourself. Do you use stonewalling and content? There are so many things that we do to our partners to communicate how we feel about them and how we feel about the relationship. I do think that it's important that we understand what initially drew us to our partner. So, what do we like about them? How do we feel when we're with them? Is there a way for us to get back to the joy that we initially felt in that relationship? Can we increase the level of attraction that we have to our partner? Can we go on more dates? Are there certain things that we can be doing to have fun in the relationship? Are we friends with our partner, right? Can we be doing things that make us feel close with them and see them for who they are as people and identify what initially drew us to them? I would say that the three words that I identify with self-healing are curiosity, compassion, and forgiveness. So within those three words, there are so many ideas, so many concepts that we're going to draw upon, but forgiveness incorporates acceptance, right? Accepting every aspect of our past, accepting past behaviors, accepting our feelings, forgiving ourselves for maybe acting then how we wouldn't act now. Were there things that clouded our judgment? Curiosity in understanding, can I see things from a different perspective? Do I have a different perspective now than I had in the past? It's important to be curious about different aspects of our past because as we move through life and as our perspectives change, we are going to have different opinions on how our past impacts our present. It's the same theme of psychodynamic therapy that understands that we're going to have different perceptions of events. We're going to have different perceptions of people, maybe the roles that our parents played in our lives, or our siblings, or trauma, or different events that have occurred are going to impact us in different ways. The most important thing is to be able to accept these different things that have happened, make peace with them in a sense. Compassion is important in healing ourselves because especially in session, there are going to be so many emotions that come up, and that's all normal. There's no right or wrong answer here, and everyone's journey looks different. And so being compassionate in allowing ourselves to feel our feelings, even if they don't make sense. Maybe they won't make sense later. Maybe they will make sense later, but being non-judgmental and having that compassion for ourselves, what we have been through, understanding that emotions might come up from an event that happened 10 years ago, right? And That might be confusing. Why is this coming up now? Why am I feeling sad now? But that's okay. It's normal. That's part of the healing process. The ability to tolerate distress, both in session and out of session, when we're talking about these really challenging things that have happened, whether it was a year ago or 5 years ago, or maybe during your childhood, being able to speak about those events, feel the feelings associated with it, and move through that, move past it. If we need to incorporate tools to enable you to move past those things or move through those emotions, we will do that. But understanding that you have the ability, you have the strength to process trauma, challenging events, maybe a breakup, maybe a death, grief, loss. There are so many things that we're going to talk about that might come up based on your journey, based on what you've experienced, that having these three elements of compassion and curiosity and forgiveness for yourself and others all come into play. I would say, going from the last question, being able to be compassionate with yourself and also curious. So when you first enter therapy, like I've said, no one's journeys are the same in therapy. Everyone has different experiences. Everyone has different things to bring up, to talk about. Some people, they want to process the same event throughout multiple sessions. Some people have new things to bring up every session. And so initially, we often start going to therapy for one reason, and we end up talking about multiple other things, other events, other feelings. And I believe that this is all related to our past and how our past impacts our present. So therapy can be scary. It can be really scary to be vulnerable, but the more that we talk, the more that we remember. And the more that we are able to be transparent and be vulnerable with ourselves, that's when the healing starts. And that also increases confidence. The ability to talk about these really challenging things that maybe we never thought that we would be able to talk about, that improves confidence. You can do that. You have that strength. And I'm going to be here for you. You're not on your own in this journey. I will walk right alongside you. And this is where self-healing begins.